Hello, everyone. I'm Dr. Angela Mattke, and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at the Mayo Clinic Children's Center, and twice per month I host a show about pediatric health topics where we take and answer your questions live. April is National Child Abuse Prevention Month, and the focus of our discussion today. 1 in 4 children will experience abuse and neglect at some point in their lives, and 1 in 7 have experienced abuse in the last year, according to self-reports from the National Survey of Children's Exposure to Violence. Recognizing and reporting abuse is very important for the safety and well-being of children. By increasing awareness of prevention efforts, we may have a greater impact on more children. We'll start our discussion today by discussing how to recognize signs of abuse and neglect. And then we'll move on to the important ways we can help prevent abuse and neglect from happening. And lastly, we're going to discuss how therapy dogs can be used to help children who've been abused and neglect cope during medical examinations and procedures. Joining me today to share his expertise is Dr. Arne Graff. Dr. Graff is a family physician with subspecialty training in child abuse pediatrics. Dr. Graff is also the medical director for the Mayo Child Family Advocacy Program and assistant professor in family medicine and pediatrics. At the end of the broadcast, Dr. Graff's therapy dog, Hasbro, will be joining us. So please stay tuned, and you can meet Hasbro later on, and also send any relevant questions you have regarding our topic today for our guest. So, Dr. Graff, thank you so much for joining us here today.
Good morning. Thank you for inviting me.
Child abuse pediatrics is a subspecialty that not a lot of people are aware of exists. Can you share with us your journey and how you ended up in this field?
Sure. So I was practicing in family medicine, and I had a large children population in the kids I saw and adults. And a couple of pediatricians who were doing this asked me to volunteer some time, and I got caught up in it. As family docs and pediatricians, our job is safety in kids and families. So I did it for a while, decided to get smarter at it, got lucky and got accepted for a fellowship, and went and completed a fellowship, and then have moved back to the Midwest, which I love living in. It's where I grew up, and have continued with it. But it's I guess probably something I should have started 30 years ago.
Well, we're happy you're here and leading our program at the Child Advocacy Center here. Let's start by talking about what are the different types of abuse and neglect, because I think we need to lay the groundwork so we can kind of build on how we can actually work on preventing some of these efforts.
Sure. So neglect is probably by far the most common, probably 70-75% of all the cases that ever get reported or get recognized. And neglect, again, what we're talking about is not just not having the nicest clothes or the new iPad. We're talking about school and dental, medical care, supervision, things like that. And then physical abuse, where there's actual harm to a child, where there's an injury that's caused either a broken bone or a bruise or more serious injury. Sexual abuse, of course, where there's inappropriate contact with a child by someone who's older. And then things like emotional abuse, where children are not given the emotional support that they need, or they're called names and berated, so they're very much put down and hurt by the words. And then there are other things like dental and a variety of other kinds of abuse.
Okay. One other area that thankfully has been getting a lot more press over the past 10 years is child trafficking. Yes. Where does that fall in the different kind of types of abuse?
I would tell you that I think trafficking is by far the most severe type of abuse that we see. These victims, and trafficking tends to start at about age 12 or 13. These victims have got every type of potential problem: physical abuse, emotional abuse, immunizations are behind, their education's behind, they have no home, they have no family. So they're a very complex victim that we see, and plus they're trapped within the system, and they have no one that can support them, and they can't easily walk away from it.
And these victims of child trafficking are everywhere. They're in our communities, and I think that's an under-recognized problem that's going on, that people aren't realizing that is happening where you live.
I think that's an important point. I think most people think big cities like Minneapolis or Chicago, but it happens in any community, and we have a significant amount right here in Rochester and in our region that law enforcement and task force work very hard on trying to recognize, educate, and get these victims some help.
Absolutely. What are some of the signs of the different types of abuse and neglect that exist, so people can recognize them when they're occurring in children that they know?
I think the biggest challenge is that, first of all, kids heal fast. And so many times injuries that children get from some type of abuse are gone within a relatively short period of time, even with sexual abuse. So I think clearly if there's an injury like bruising on a child that's not appropriate, or a broken bone where there's no history for why the injury would occur, I think those are helpful. But I think the other thing is just behavior changes in kids. Kids who are doing well in school who suddenly are withdrawn or becoming very aggressive or not showing up for school or not getting out and seeing family members. We don't see them for weeks and months at a time. Raises the concern that something's being hidden. But I think the biggest challenge is just recognizing behaviors, not overcalling, but recognizing when something changes that we open the door to make sure nothing's going on.
Absolutely. What should someone do if they are recognizing some of these signs or have concerns that maybe something traumatic is going on in these children's life?
I think the first place is if you have some relationship with the caregiver. First, you can talk to the child, and you can talk to the caregiver and just say, "I'm concerned. I have these concerns." You may be told to butt out. If their concerns are pretty significant, if you've noticed injuries, let's say bruising on the face, and there's no history, then I think one can reach out to social service and in the county and express your concerns. It's up to them to decide how to screen it and what to do. It's anonymous, which helps, and I think that's probably the starting point for most people.
Who are mandated reporters of child abuse?
Well, all professional type people are, and people who are involved in child care.
Okay.
But, in a number of states now, every adult, because of some of the things that have been in the news the past 5-6 years, all adults have become mandated reporters. I think it's only a matter of time when it will include all of us. So in a sense, we're all mandated, we're all reporters. It's whether or not we're willing to take that step when I'm not a teacher or I'm not a physician or something.
Right. So, and you mentioned earlier it's up to the county to decide what happens, but the mandated reporter's job is to just raise concerns and say something is going on.
That's correct. Yeah. It's to say, look, something is out of place here. I'm concerned, and then it's the county's job or law enforcement, depending on the situation, to go in and inquire, not go in and arrest people. I think the biggest barrier for people who are concerned about reporting is they're worried about prosecution. Yeah. They're worried about kids getting pulled from a home and parents going to jail. And that's the majority of the time, that's not what happens. It's about services getting in place that really are needed and support for the family, and they're actually doing a huge benefit for the family.
Absolutely, and that kind of gets into the prevention measures that we'll talk about later on, and ways that we can help support these families and prevent further abuse and neglect from occurring. And so we'll talk more about those later. But tell me a little bit about what happens in that process. So say that the investigation is maybe started either in Child Protective Services or in law enforcement. What does that look like for the child and the family going through it?
So there are different ways that the counties have investigation responses and alternative kind of family responses. And the counties are very well skilled at this. And in the past couple of years, there have been some huge steps in improving on this. But most of the time, it's going to be first to reach out to the caregivers and to the child. If the child's verbal, then most of the time, county is going to want to talk to them and ask them what's going on, and to reach out to the parents. If they're deciding that this is something concerning for abuse, then many times kids with verbal skills will then have a forensic interview. And the forensic interview is usually conducted at like a children's advocacy center, which is a neutral environment where multiple agencies can come together for the benefit of the child and the parent, not about putting people in jail. The child then has an interview, is able to tell their story, and the team then offers suggestions about medical care that might be indicated, safety plans, mental health concerns for these kids and the family, and then it kind of evolves from there depending on whether it's validated or it's not.
What about children having difficulty disclosing this type of information? I would imagine that not all children are ready at that moment in time to tell people what has happened to them if there was some type of abuse or neglect that existed. How often does that happen?
Yeah, delayed disclosure is more common than actual just talking about it. Actually, the teenagers tend to be the group that tend to talk about it more early on. But delayed disclosure is very, very common. And in fact, the oldest I've seen was an adult in their 50s who finally talked about something that happened.
Okay.
I think it's important for us to keep in mind that kids don't talk for a variety of reasons. One, they don't know it's wrong. They don't know that everybody else doesn't exist in this same world like theirs.
Mm-hmm.
Sometimes they're groomed, where they're offered treats, particularly with sexual abuse, or they're threatened. I will hurt your family dog, or I'll hurt your brother if you tell anybody. And they believe it. And kids are taught to believe and trust adults. Mm-hmm. So it's a challenge. So the vast majority of the kids, there is some delay in disclosure. Plus, they also feel guilty, like somehow it's their fault this is occurring.
Right. Absolutely. You mentioned grooming. Can you explain to us a little bit more about what that might look like so people can mm-hmm. recognize that when it's happening?
The grooming approach is simply to try and maintain this relationship. Mm-hmm. And as concerning as it is, and public probably not always aware, things like sexual abuse oftentimes last sometimes months and years. So offering a new bicycle, a new iPhone, things of this nature that make the kids feel good and mm-hmm. think this is a relationship that's normal is what they're trying to encourage, because they're not trying to frighten the child or make the child angry and divulge what's going on. It's their secret.
Okay. We have a question from our audience, and I think this is a great question. So she asks, how and what kind of questions should she ask her 12-year-old if she suspects that her daughter is being inappropriately touched by close family members?
Well, so I think the part to start is, how do I get this information out in the first place so they'll even talk to me? Mm-hmm. So I think what you want to do again is, as kids are getting old enough to understand things, is first of all, we talk to them about their body parts. We talk correctly about the body parts. Everybody's got their little names for the genital area, but mm-hmm. being able to say penis or vagina mm-hmm. so that when the kids have something to disclose, they use the correct terms. Mm-hmm. And at the same time, talking to the kids about your body is your body. Nobody else should be touching it, mm-hmm. and explaining this to them, and that if someone does, that it's okay to come to mommy or to daddy mm-hmm. or to their teacher mm-hmm. and just say something. If we're 12 years old and we're concerned, I think what we do is we don't interrogate them. Mm-hmm. We sit down and we say, hey, how are things going? And I want you to know that this is a tough age. There's a lot going on in school, bullying and things like that. And if you're ever concerned about something, mm-hmm. I'm here. And it's not your fault, and I want you to come and feel safe talking to me about it. Mm-hmm. And I think as long as you leave the door open and you accept the fact that it can exist, mm-hmm. It'll allow the kids to come and talk to you.
Mm-hmm. And as you mentioned, some of those other signs that you would see in a child in this age, for families that if they have concerns about inappropriate touching, and they're also seeing other concerns, should they bring this up with their medical provider, or what would be a way for them to go about it?
It's an excellent idea. Mm-hmm. I think, most pediatricians and family docs with the kids in their practice have got a good relationship. Mm-hmm. And I think that's a great idea. What you do is you can call ahead and say, mm-hmm. hey, Dr. Graff, Susie's coming in tomorrow, and we have some concerns. And most of the primary care people are all trying to ask mm-hmm. this anyway, because mm-hmm. we want to keep that door open. Right. But I think use those people out there to be part of your team to help with your kids, and it may not be that. It may be something else. It may be drugs, mm-hmm. Or bullying or something mm-hmm. else.
Absolutely. So we really want to focus on prevention. This being the way that we can hopefully change the abuse patterns going forward in the future. Mm-hmm. You mentioned a couple ways that you can start by teaching your children about safety, about touching. What kind of language should you use when you're talking about touching? I hear people say things like good touch, bad touch. Right. What is the language you should use, and how early should you start talking about these things?
It keeps changing, because mm-hmm. good touch, bad touch implies something, yep. or touches you like we mm-hmm. used to use, and then it's, they don't necessarily know this is not a touch that should happen.
Right.
I think what you do is you talk about parts of your body that are not okay for other people to touch unless mm-hmm. you're going to the doctor, yep. or mom and dad are helping you after a bath or something. Mm-hmm. So we talk about those areas covered by our swimsuit, okay. and we talk to the kids about that and just say, this is an area no one really should be touching on your body. Mm-hmm. And I think that gives, and the other thing is, and you know this very well from mm-hmm. your practice, simple is better. As adults, we get so complex. Kids don't want a long explanation. They want something very basic and in their words. So.
Yep, very basic and very black and white and concrete.
Yes.
Use simple language with that.
Yeah.
You mentioned using correct terms for genitalia, and I can't emphasize this enough. In my office, I will use the correct terms and start trying to introduce it to families. Then, if they're not already using it, how early should parents start using correct terms?
I don't see any reason why you don't use it right from the beginning.
Exactly.
Yeah, because I think between adults, as mom and dad or whoever the partners are, if we're using little words, kids are hearing that. And I think, we use the correct terms right from the beginning. In the old days, everybody was afraid to say these things out loud. Not so much anymore.
How do we enable children to speak up if they feel that something is hurtful to them or something uncomfortable is going on that they feel that probably isn't necessarily right?
Well, I think, again, talking to them about it. I always encourage parents about once a year just to sit down with your kids and say, and right before school is a great opportunity. School's coming up, and there are kids who are sometimes naughty, and if you ever worried about this, or if there are adults, that we should be able to talk about that, and you can always come to me. Now, the key to that is then stopping what you're doing and sitting down when the kid comes to you, because if we say that and then they say something and we blow it off or we minimize it, then we give a very clear message that I don't believe you. So it's not just the teaching, but also really following through, and I think that's critical.
Absolutely. And it needs to be an ongoing discussion. It's not a one-time thing that happens where parents feel like, oh, I checked that box off, I'm done. But it needs to be an ongoing discussion starting early, so it doesn't, one, feel awkward for the children, right?
Correct.
As they get older, so that it's a continuity discussion as they get older and engaging and talking about their sexuality as well, and what they're going to be going through puberty.
Absolutely. So it's not, as you just said, it's not just about little kids not letting somebody touch them. It's now you're 15 or you're 14 and you're dating. Let's talk about respect for the partners that you may have. What's appropriate, what's not, because we don't want kids letting hormones run their life and get them in trouble. And we want them to understand as a young person that respect for the other people so that it carries through into adulthood. I mean, we can start to get ahead of domestic violence and a lot of issues that we have if we have those discussions with our kids young. And as you said, continue to have the discussion. It's ongoing because it changes. If you're in sports versus pep band or whatever, there are things that are unique to that child.
Absolutely. What are some other ways that we can help engage or support families to hopefully kind of prevent abuse from happening?
I think we start in the nursery. We talk to new parents. We talk about frustrations. And I think people should be helpful in mentoring, not meddling, but, mentoring, again, families to be able to say, hey, maybe you guys want a date night this week, and we'd be happy to watch the baby. Also supporting parents about, like I would always tell parents when I was delivering babies, I would say, there were days I wanted to leave my kids on someone's doorstep. And it allowed them to say, oh, Dr. Graff gets frustrated too with screaming children or things like that. So I think normalizing what is frustration, but then giving something. What do you do with the screaming, crying baby? Talk to your pediatrician, talk to your family physician about it, so you can give them something that'll help them feel more comfortable. Talk about safety. Who do we leave our kids with? When we send them to school for 6 or 8 hours a day, but then we drop them off with a neighbor that we've met 1 month ago. So thinking about what's appropriate.
Absolutely. What about ways that we can help children understand kind of their own emotional intelligence and coping mechanisms? Any thoughts on that, so that if as they get older, they start to regulate their emotions a little bit better, and so that tensions aren't escalating in the family? Because emotional intelligence and learning is so important as children get older.
Yeah. Well, I think part of it is it reflects us. So if I'm a parent who every time I get upset about something I spank my child,
absolutely,
then I'm not dealing well with my emotions, and I'm showing them that physically when I get upset, this is how I respond. And we all know that the brain is developing until probably somewhere around age 25. So there's constant change going and very immature. So as a parent, first, just recognizing that they're volatile. And we were all there also. And accepting that, But again, setting parameters. What's appropriate discipline at 3 and when I'm 15? Having something that says these are things that we don't do. And if we do them, then there are consequences. And so that we learn about discipline, not punishment. And I think that helps the kids be able to understand what's okay and what's not. And they start to have they have thresholds that they know they can't exceed at various age groups. But again, if the parent isn't following that, if dad gets mad and he punches a hole in the wall every time he gets upset, it gives very clear message to the child, irregardless of what else I say.
Absolutely. So consistency, consequences, following through on things, and lots of positive kind of interactions with your child are really good, effective forms of parenting and discipline, right?
Yes.
Because they go hand in hand, having those positive interactions on the forefront, and less negative interactions that sometimes lead to ineffective discipline techniques.
Correct.
Yeah. Let's move on for a second and talk a little bit more about something called ACEs, and because you mentioned about a parent punching a wall and stuff like that, and maybe being exposed. How does being exposed to maybe domestic violence or poverty or hunger? How does this affect the child's developing brain?
We know from very good studies that have been replicated that if kids are exposed to adverse events, so that can be domestic violence, it could be emotional abuse, name calling, or lack of positive support, physical abuse on a regular basis. If kids are exposed to this, multiple types or one type, but repetitively, there are a couple things we see. Number one, we certainly see changes in the child at that time, potentially. Behavior changes, injuries certainly have consequences. As a teenager, we see a population of kids who are high risk takers, drugs, sex, legal, and statistics show it, they get into more trouble and they have higher pregnancy rates, higher infection rates. But what's really concerning is that if you fast forward this 30 or 40 years, so you take this child and make them a 40-year-old adult, everyone would guess that the risks of mental health problems, anxiety, depression, PTSD would be there. And it is, or it can be. But the risk also is for medical problems, asthma, heart disease, diabetes, inflammatory bowel disease. Again, something is triggered as a child and changes so that the consequences down the road for physical ailments are very real also. So we see both emotional and physical potential long-term effects if we don't interrupt the cycle down here.
Absolutely. And parents using those positive parenting techniques and those coping mechanisms early on, and having supportive communities and other things we can do to kind of support families going forward.
Absolutely.
So that these children are not continuing to experience this repetitive adverse childhood experience. So
so for instance, we know that if children are exposed to cocaine during the pregnancy in high doses, we know that the most positive thing that can affect these kids for being normal down the road is a positive home environment, whether it's biologic parent or foster parent, and these kids do well. So we know it's stimulating, nurturing, consistent, safe environment, which is what we all want for our kids anyway.
Absolutely, and we want for all the children in our community as well.
That's right.
So other people who can step in and fill some of these roles at times as well.
That's an important point. It's about keeping our community safe. We focus on our child. I can't fix what's going on in Minneapolis or in Chicago, but I can focus on my children and on my community. And if we all work as parents and we all want the same thing, we can have huge success.
Absolutely. Let's move on to talking a little bit about how you're using therapy dogs in your practice. So therapy dogs are used to help both children and adults seek comfort during difficult times. Therapy dogs are not to be confused with service dogs, which are dogs that are specifically trained to help people with certain medical conditions such as hearing or visual impairment, mental health disorders, autism, epilepsy, and diabetes. We're going to talk more about the use of therapy dogs with children. And joining us today is our special four-legged guest, Hasbro, the therapy dog.
Come here, bud. Come here.
Hasbro is taking a nap down here, and he's going to come sit up and introduce himself. Hi, Hasbro. Hey, buddy. How are you? I can see why the kids find you comforting. So how do you use Hasbro in the Child Advocacy Center?
Well, so again, you're very correct. These are not service animals. They are therapy assist, and so their role is to be there to be a source of support.
Yeah.
And the idea is to sit there and allow the kids to talk to them and pet them and visit and reduce stress and anxiety. Quite frankly, for the parents also, as it's a pretty stressful situation.
Yeah, absolutely.
Right, thanks, buddy. There are places that use the dogs when forensic interviews are conducted, so the dogs can lay in the room as a support. There are places that use the dogs to be involved in court, where they can again go to court and sit there and be a source of support, just like a doll would be, or a teddy bear or something of that nature.
Yeah. What is the research? Because there actually has been a lot of research on how the use of therapy dogs affects, hormones in your brain, to maybe even increasing disclosures early on with child abuse.
Well, the studies clearly show that again, it reduces anxiety and stress, and it allows kids to feel more comfortable talking about things that are bothering them. Now, they may not at that time disclose, but they may, again, feel more comfortable that they can down the road. But clearly the effect on the kids to take away the stress and anxiety and just allow them to just feel okay about, like they haven't done something wrong. Same with the parents. Again, if kids have parents who are under a lot of stress and anxiety, kids are very good at reading parents. And if they're upset, then it's going to be a problem for the children also, because they're going to sense the anxiety and stress. Long-term effects are clearly beneficial for the kids, and people use rabbits, they use dogs. In some countries, they use turtles, horses, equine.
Yeah, equine
so
therapy,
a lot
absolutely.
of different therapy that's out there.
Absolutely. What are some other ways we can use therapy dogs, especially with children, other than like a forensic interviews?
Well, again, animal assist dogs, just visiting them in the hospital and even in the clinic.
Yeah.
Allowing people to just sit and pet. Studies really show that just sitting and petting the dog and having that dog calm and sitting around you just reduces our blood pressure, our heart rate, our cortisol levels in our body. We use the dogs around college semesters and even the medical students because during test times, the college students, to have 3-4 dogs, they can just walk over, take a break, sit down and play with them. Yeah. It just reduces things for them and it just makes them feel better.
I saw a video about how they're being used for procedures as well. And so some of the dogs have been, you can even show children how to look the other way when maybe a needle draw is being done or a procedure is being done. And I know we use therapy dogs in our hospital, and most children's hospitals are using them as well.
We do.
And you had shared with me earlier that you used to use him with some adult therapies as well.
Right. When Hasbro first started, and again, they have to go through a training and they have to be certified. Okay. We started out in the stroke rehab unit at a hospital I was at, and it was mostly old ranchers and farmers who had strokes and couldn't talk, and they all had dogs, of course, when they were back on their farms. So he would just come and sit with them for a half an hour, and in and of itself, that was just therapeutic.
Absolutely. Well, thank you so much for joining us today. Oh, lots of kisses, lots of kisses. It was fun to meet you. You're doing great work. And you, Dr. Graff, are doing great work as well.
We're just part of a team, and it takes everybody, parents included, and parents need to understand that this is all about us helping them keep their kids safe.
Absolutely. Thank you for all the kisses, buddy. Well, that is the end of our show today. Thank you all for joining us. The next Ask the Mayo Mom will be on 5/4, which will be May 4th at 10 a.m. Central Standard Time. The topic is going to be treating brain tumors in children with proton beam radiation therapy, which is a new and emerging therapy to replace traditional radiation therapy techniques. We'll be discussing why it's sometimes more optimal to be used in children, and my guests discussing this will be Dr. Nadia Locke and Dr. Amula Rao. So please join us, and you can feel free to send your questions in advance. Thanks, everyone, and have a great day.